We have a health and public health crisis on our hands, particularly in the prairie provinces.
The number of babies born with congenital syphilis in Canada is rising at a faster rate than it is in the United States and Europe, with major increases in the prairie provinces, including right here in Manitoba. According to data from Health Canada, syphilis cases in babies have skyrocketed over the last 5 years, and preliminary government data obtained by Reuters shows the cases are expected to increase in 2022.
This is an urgent need right now that needs a response. We can't be waiting.
Syphilis is a sexually transmitted infection caused by a bacteria. Congenital syphilis occurs when a mother with syphilis passes the infection onto her baby during pregnancy. Dr. Sean Rourke says many mothers are not getting the prenatal care that they need, especially in remote and First Nations communities.
These are folks, too, that have been dealing with intergenerational trauma, colonization, and complex social health circumstances, and it's all of those things together, I think, that have led to this where we are today.
The data shows the rise is concentrated in the prairie provinces, with Manitoba recording the highest rate of cases at 371 per 100,000 live births in 2021. Dr. Jared Bullard says Manitoba didn't have any recorded cases of syphilis from 1977 to 2015, but he says a number of factors have led to the recent resurgence of the disease.
Often it's people who are poor, living in poverty, experiencing homelessness. A lot of the time there may be an inaccess or inability to access the healthcare system. It might also have to do with addictions and injection drug use, and then also mental health often comes into play as well.
Pediatrician Dr. Marnie Hanna says syphilis is a problem that can impact many systems in the body.
If we're concerned about syphilis, we're doing imaging of their brain and a lumbar puncture, which, is definitely not fun for a newborn, and a whole bunch of blood work. So they get quite a workup, and then they need a more prolonged course of antibiotics to deal with it.
Health Canada has approved a syphilis and HIV test that can provide results in under a minute. Rourke says the federal government needs to provide these resources immediately.
We haven't been paying close enough attention to the health needs of these people, and we need to do a much better job.
In Winnipeg, Alex Karpa, City News.